Initiative for Health Accountability and Transparency welcomes you to our Continuous Professional Development Academy. And this course that we're going to look at is the first series of the management skills, and it is on problem solving and decision making. The CPD Academy is the learning hub for health professionals, irrespective of the health workers field. I am Dr. Adeyemi Adedoyin. I'll be your instructor for this course on problem solving and decision making. In the course of this presentation, it is advised that you have your writing materials with you, with which you will take down notes. Please note that everyone that takes this course would have access to the following course materials. There will be a graded pre-test quiz to assess your level of knowledge and understanding of this subject matter. There will be a video which discusses in details problem solving and decision making. Also, you would have access to a downloadable PowerPoint presentation which provides more information on this subject. At the end of the course, there will be a graded course completion examination. We will also give you some suggested resources for further study on problem solving and decision making. However, those who choose to have a course completion certificate and a continuous medical education credit will need to achieve 75% pass and pay a little fee. We will be looking at the following outline during this presentation. We will learn at the objectives that this course should achieve at the end of it. We'll look at a brief introduction. We'll understand the concept and features of the word problem. We will be able to define, cause, select alternatives in problem solving. We'll look at problem solving skills and implementing a solution. We'll also look at problem solving processes and techniques. We'll look at decision making, its meaning, process and techniques, and also the hindrances to effective decision making. Specifically, at the end of this course, every participant will be able to understand the concept of problem and problem solving. We'll be able to discuss how to select problem solving alternatives and implement solution, explain problem solving skills, be able to discuss problem solving process and techniques, decision making process and techniques, and describe the hindrances to effective decision making. As a way of introduction, we all know problems are common everyday occurrences in our lives. They occur at workplaces, including healthcare settings, our hospitals, homes, and communities. We must also accept that problems are inevitable. While some problems may be mild or moderate, others may be severe or complex. If we can learn to accept problems as a normal, regular, and completely unavoidable part of life, then we can handle them more easily with grace. Traditionally, problem solving is accompanied by decision making. Hence, problem solving and decision making are closely related management skills. Because we deal with problems every day, everybody can benefit from having good problem solving skills. It is important to have capacity to solve problems efficiently and in a timely manner. Unfortunately, there is no one way in which all problems can be solved. Therefore, a crucial factor that determines whether problem solving is a success or failure is to have good judgment. Let's take a brief brainstorming session on the concept of problem. Please take a few seconds and note down in your own words, key words, your understanding of the word problem. A problem is an unsatisfactory state that needs to be changed to a desired state. It is a deviation from the expected standard which prevents the achievement of desired objectives. It can also be seen as a perceived gap between the desired state and the actual state, a gap between one's expectation and the reality on ground. So basically, the fundamentals of a problem are an unsatisfactory or deficient state, deviation from the expected standard, a perceived gap in the actual state, an absence of desired state, non-achievement of desired objectives, and non-existence of an ideal state. Did you correctly note down any of the keywords in the definition of the word problem? If you did, well done. And if not, you can always go back to the slides to understand the word problem. When faced with a problem, it is useful to consider the following questions. Is the problem real or perceived? Are you sure there's actually a problem? Is this problem really an opportunity for growth, for improvement, or adjustment in the way things are done? Does the problem need solving? These are the questions we need to ponder on when we are faced with a problem. All problems have two features in common. There is always a goal and a barrier. The goal is what you set out to achieve. That is, setting out to achieve some objective or a desired situation, or you are trying to avoid a situation or an event. While the barriers are the obstacles that prevent the achievement of those goals in problem solving. To further buttress these points, a goal is what you wish to achieve or where you want to be in solving a problem. Examples include ensuring uninterrupted supply of drugs and consumables, or reducing patients' waiting time to acceptable level before consultation. As we said earlier, barriers are the obstacles that prevent the achievement of goals in problem solving. If there were no barriers in the way of achieving a goal, then there will be no problem. Examples of barriers include failure to recognize a problem. If you don't know that there's a problem, then there's a barrier in problem solving. Also, conceiving the problem too narrowly. You feel the problem is a minor one that doesn't need to be addressed. That is also a barrier. Making a hasty choice. After identifying that there's actually a problem, you don't have deep analysis of the problem. You just quickly make a decision. That is also a barrier. Failure to consider all consequences. After deciding on what to do, did you think of the effect, the consequences of the actions to be taken? That could be a barrier. Failure to consider the feasibility of the solution. You have decided on the action plan. You have decided on what to do. But will that be possible? Is it feasible? That could also be a barrier in problem solving. Now let's go further to problem solving itself. It is a set of activities designed to analyze a situation systematically and to generate, implement, and evaluate solutions. So these activities involved in problem solving include defining a problem, determining the cause of the problem, generating alternatives for a solution, selecting alternatives for a solution, implementing the solution that has been selected, and evaluating that solution. Let's quickly do another brainstorming session on problem-solving skills. Take few seconds and note down in keywords the types of skills that you think are required in problem solving. We'll be looking at 6 basic skills required in problem solving, and they include creativity, research, teamwork, emotional intelligence, risk management, and decision making. Now let's take these skills one after the other. Creativity. Problems are usually solved either intuitively or systematically. Intuition is used when no new knowledge is needed. You already know enough to be able to make a quick decision and to solve the problem. Or you use common sense or experience to solve the problem. Systematic and logical approach is used for solving problems that have not been experienced. Defining and solving problems often requires you to do some research, and this may be a simple Google search or a more rigorous research project. On teamwork, we know that many problems are best solved with the input of other people. Teamworking approach to problem solving is important at all levels: in the home, school, workplace, hospitals. Teamwork is an important skill that everyone needs to acquire. Emotional intelligence is another important skill required in problem solving. It is worthwhile to consider the impact that a problem or its solution can have on yourself or on other people. The use of emotional intelligence is the ability to recognize the emotions of yourself and others, which will help guide appropriate solution. Please note that solving a problem involves a certain amount of risk, but this risk needs to be weighed up against not solving the problem. That is, when you are faced with a problem, you decide whether to solve the problem because of the risk that will be encountered, or you leave the problem as it is to avoid such risks. The last but not the least skill that we'll be talking about is decision making. Problem solving and decision making are intertwined management skills. Making a decision is an important part of the problem solving process. Did you correctly note down any of the problem solving skills? If you did, that's a great job. And if not, there's still room to go back and check the slides again. Let's consider problem solving process and techniques. Some problems are small and can be resolved quickly, while other problems are large and may require significant time and effort to solve. For example, an orthopedic surgeon encounters a simple fracture. That is quite a small problem in his hands that can be resolved quickly. And another patient comes in with multiple compound fractures. Of course, they will first stabilize the patient, but he will now have to think of how to set the bone such that there will be minimal loss of bone, and the person can have a good outcome at the end of it all. So solving that problem may take more time than solving the simple fracture. These larger problems are often tackled by turning them into formal projects. Whether the problem you are focusing on is small or large, using a systematic approach for solving it will be more effective. Let's consider the steps in problem solving. We're going to look at 6 steps in problem solving. First, you define the problem. You now determine the cause of the problem. You generate ideas. You make decisions. You take action, and you now monitor the solution that you have implemented in the problem solving. We'll be looking at each in details. The first one is to identify and define the problem. The way you define a problem will determine how you attempt to solve it. And this step involves detecting and recognizing that there is a problem, identifying the nature of the problem and defining the problem, such as, is there a problem or are there problems? What is the nature of the problem? How can the problem be best defined? If you receive a complaint about a member of your team from a client, the solutions you come up with will be based on the way you define the problem. If you define the problem as poor performance by the team member, you will develop different solutions than if you define the problem as absenteeism from duty posts. There are benefits of proper identification and clear definition of a problem. This allows better understanding of the problem, and there is effective communication of its nature to other people. The next step we'll be looking at is to determine the cause. This involves a period of observation, careful inspection of the problem, a fact-finding process, and developing a clear picture to determine what is causing the problem. Determining the cause of a problem involves a detailed analysis and building a more comprehensive picture of both the goals and the barriers. If your solution fixes a symptom instead of an actual cause, the problem is likely to reoccur since it was never truly addressed. This stage may not be necessary for very simple problems, but it is essential for problems of a more complex nature. One can use a fishbone diagram to determine the cause of a problem, and this is a tool used to perform a cause and effect analysis to make sure your solutions address the actual cause of the problem instead of the symptoms of the problem. It enables us to discover the root cause of a problem. A cause and effect diagram can be created in 6 steps. You first of all draw the problem statement. You draw major cause categories. What are the categories that can be the cause of this particular problem? Then you brainstorm on these causes. You now categorize these causes. You determine deeper causes. Maybe there are even deeper causes apart from these peripheral causes that have been identified. You now identify the root cause. The third step in problem solving is to generate ideas. Once the problem is defined and its causes has been completely determined, it's time to generate ideas or possible course of action, but with little attempt to evaluate them at this stage. Many alternative solutions to the problem should be generated before final evaluation. A common mistake in problem solving is that alternatives are evaluated as they are proposed. This ought not to be so. So the first acceptable solution is chosen, even if it's not the best fit. That is when the alternatives are evaluated as they are being proposed. You now make the mistake of choosing the first acceptable solution, and it may not be the best fit. 2 great problem-solving methods that are used for coming up with solutions are brainstorming and mind mapping. After generating your ideas or alternatives, the next step is to make decision to select the best solution. This involves careful analysis of the different possible solutions or courses of action that you have selected, and then you pick the best for implementation. One problem-solving technique that can be used to decide which one is the best solution to the problem is a simple trade-off analysis. To perform the trade-off analysis, you define the critical criteria for the problem that you can use to evaluate how each solution compares to each other. The evaluation can be done using a simple matrix. The highest ranking solution will be your best solution for this problem. Some solutions may not be possible due to other problems like time constraints or budgets. It is important to consider what might happen if nothing was done to solve the problem. Solving a problem that can lead to other problems requires some very creative thinking and innovative ideas. Still on making a decision, when selecting the best alternative, a number of considerations will need to be made. Will that particular alternative solve the problem without causing other unanticipated problems? Will all the individuals involved accept this alternative? Is successful implementation of this alternative likely? Does the alternative fit within the organizational constraints? These are the things to take into consideration when making a decision. Then finally, a decision on which course of action can then be made. Once you've made your decision and you have determined which solution you want to implement, it's time to take action. If the solution involves several actions or requires action from other people, it is a good idea to create an action plan. Leaders may be called upon to direct others to implement the solution or to facilitate the implementation with the help of others. Involving others in the implementation is an effective way to gain buy-in and to support and minimize resistance to subsequent changes. We'll be looking at the last step in problem solving, which is monitoring or seeking feedback in problem solving. It is the last stage, and it involves reviewing the outcomes of problem solving over a period of time and seeking feedback as to the success of the outcomes of the chosen solution. It is concerned with checking that the process was successful, and it can be achieved by monitoring and gaining feedback from people affected by any change that occurred. It is good practice to keep a record of outcomes and any additional problems that occurred. Regardless of how the solution is rolled out, feedback channels should be built into the implementation. This allows for continuous monitoring and testing of actual events against expectations. Problem solving is most effective if the solution remains in place and is updated to future changes. In simple terms, in monitoring in problem solving, these are the steps you take. You review the outcomes, seek feedback, you keep a record of outcomes, and you ensure solution remains in place and updated. We'll be going into further details on decision-making process. This is the act of choosing a course of action between possible alternatives in the problem-solving process to achieve some predetermined objectives. It involves commitments towards a particular course of action. It helps managers to identify organizational problems and they now attempt to solve it. Decision-making is carried out at all management levels in an organization. In organizations, decisions are made in several related subject areas, which include the goal and objectives of the organization, organizational structure, its design and operations, budgets, staff salaries, wages, working hours, issues on promotion and demotion, marketing mixed products, and even research and design within the organization. all need decision-making process. There are different ways of making a decision. Decisions can be made through either an intuitive or reasoned process, or a combination of the two. Intuition is a combination of past experience and one's personal values. It reflects your personal learning about life. However, it is not always based on reality, but on our perceptions, many of which may have started in childhood. Intuition is a perfectly acceptable means of making a decision, although it is generally more appropriate when the decision is of a simple nature or needs to be made quickly. Reasoning, on the other hand, is using the facts and figures available to make decisions. Reasoning usually have its roots in the past issues that affect the way a decision is implemented. More complicated decisions tend to require a more formal, structured approach, usually involving both intuition and reasoning. It is important to be wary of impulsive reactions to a situation. It is possible to apply the two aspects in decision making in turn. You start with reasoning and gathering facts and figures. Once obvious decision is reached, it's the turn of intuition. How do you feel about the answer? Does it feel right? If not, you take another look and you see if you can work out why the solution is not feeling right. If you are not emotionally committed to the decisions you have made, you won't be able to implement it well or effectively. There are different types of decisions, and they include basic, routine, personal, organizational, individual, group decisions, rational decisions, irrational decisions, programmed and unprogrammed decisions. We'll be looking at these decisions one after the other. Basic decisions are decisions that are concerned with unique problems and situations an organization is facing. They require large investments. Example of such is the launch of a new equipment or a health service. Routine decisions have to be made during the normal course of a business. They are repetitive in nature and they require small investment. Personal decisions are informal decisions that a person makes as an individual and not as a member of an organization, and they do not directly affect the organization. Organizational decisions are formal decisions that a person takes as a member of an organization, using formal authority which directly affects the organization. Individual decisions can be taken by a single individual doing regular routine work according to the policies of the organization. Group decisions are taken by a group or a committee that is formed for a specific purpose to make an important and informed decision for the organization. Rational decisions are made after careful and systematic analysis of a problem and evaluation of several alternatives based on rational and logical facts and figures. Irrational decisions are based on intuition or experience of the decision maker and not based on relevant facts and figures. Programmed decisions are routine and repetitive decisions made by lower level executives using pre-established rules and procedures that require little time and effort, and they are easy and simple to make. Unprogrammed decisions are decisions concerned with unique problems faced by an organization for which there are no pre-established rules and procedures. Such decisions are complex and they demand lot of time and effort, and they have a long-term impact. These decisions are usually made at the top management level. Let's briefly take another brainstorming session on the stages in decision-making process. Please take a few seconds and note down the keywords in your own understanding, the different stages in decision making. In this presentation, we'll be looking at 7 stages in decision making process. The first is awareness of the problem. The second is to diagnose and state the problem. The third stage is to develop alternatives. The fourth is to evaluate the alternative. The fifth stage is to select the best alternative. The sixth stage is to implement and verify the decision. And the last stage is to get feedback. At the stage of problem awareness, the decision maker becomes aware that there's a problem to be solved. He then diagnoses and states the problem. He understands and analyzes the problem and now attempts to describe the problem and objectives that are to be achieved through solution. Afterwards, he develops the alternative. This stage involves collection of data regarding the problem and formulation of different alternate course of action that can be followed to solve the problem. The next step is to evaluate the alternative. This step involves evaluation of the various alternatives on the basis of the feasibility of a particular action, the resources of the organization, and the time period in which the objective is to be achieved. After analyzing and evaluating the possible outcome of each course of action, the most suitable, feasible, and profitable option is then selected. The next step involves implementing the decision and making sure that the selected course of action meets the expected outcome. Your follow-up strategies are prepared to react towards any counter moves of others that are affected by the decision. Decision making is a continuous process. Hence, a feedback from all the parties involved with implementing the decision is taken. Feedback may reveal another problem created due to implementation or a problem that is hindering effective implementation. This now calls for a new decision and so on. Well done if you correctly noted down the stages of the decision-making process. The PowerPoint is available for you to further understand and study this topic. Decisions need to be capable of being implemented, whether on a personal level or organizational level. Therefore, there is the need to be committed to the decision personally and should be able to persuade others of its merits. An effective decision-making process, therefore, needs to ensure that you are able to do so. However, there are a number of factors that can prevent effective decision-making. Such factors include insufficient information, having too much information, emotional attachment, no emotional attachment, when too many people are involved in the decision-making process, and when there are vested interests from the various people involved. Let's consider these factors one after the other. If you do not have enough information, it is like one is making a decision without any basis. So you need to take some time to gather the necessary data or information to inform a decision, even if the time scale is very tight. If necessary, prioritize information gathering by identifying which information will be most important to you. Having too much information is also a factor that affects effective decision making. Seen quite often is having so much conflicting information that it is impossible to see the wood for the trees. This is sometimes called analysis paralysis and is also used as a tactic to delay organizational decision making, with those involved demanding ever more information before they can decide. This problem can often be resolved by getting everyone together to decide what information is really important and why, and by setting a clear timescale for decision making, including an information gathering stage. Having too many people in the decision making process can also be an hindrance. Making decisions by a committee is difficult. Everyone has their own views and their own values. While it's important to know what these views are and why and how they are important, it may be essential for one person to take responsibility for making a decision. Sometimes, any decision is better than none. Also, decision-making processes often fail under the weight of vested interests. These vested interests are often not overtly expressed, but they may be crucial to the blockage and may be hindrances to effective decision making. Because they are not overtly expressed, it is hard to identify them clearly and therefore difficult to address them. It is sometimes possible to identify the interest by exploring them with someone outside the process but in a similar position. It is also possible to explore the rational and intuitive aspects with stakeholders, usually with an external facilitator to support the process. While looking at emotional attachments, we should know that people are often very attached to the status quo. Decisions tend to involve the prospect of change, which many people find difficult. So emotional attachment affects decision making and can be an hindrance to effective decision making. Having no emotional attachment can also be a problem. Sometimes it's difficult to make a decision because you just don't care one way or the other. A structured decision-making process can often help by identifying some very real pros and cons of a particular action that perhaps were not thought about before. Let's briefly look at the techniques of decision making. Decisions are usually made using a structured decision making process. This will help to reduce more complicated decisions down to simpler steps. It also sees how any decisions are arrived at, and it helps in planning decisions to meet deadlines. Many different techniques of decision making have been developed. The method used depends on the nature of the decision to be made and how complex it is. The different techniques include group discussion, brainstorming, Delphi technique, marginal analysis, and cost-benefit analysis. Let's discuss these techniques one after the other. Group discussion is a systematic exchange of information, views, and opinions about a topic, an issue, a problem or situation among members of a group for developing information and understanding essential for decision making or problem solving. Group discussion helps in developing a better perspective on issues by bringing out diverse viewpoints. Whenever we exchange different views on an issue, we get a clearer picture of the problem and we are able to understand it better. The understanding makes us better equipped to deal with the problem. The second technique we'll be looking at is brainstorming. This is a group decision-making technique designed to increase the range of ideas and solutions available for the group to explore. The goal of brainstorming is to generate as many ideas as possible. This technique doesn't provide a solution or decision itself. Instead, it produces a list of ideas that will later be considered, discussed, and evaluated when it's time to reach a final decision. The third technique of decision making is the Delphi technique. It is a process used to arrive at a group opinion or decision by surveying a panel of experts. The method seeks to aggregate opinions from a diverse set of experts, and it can be done without having to bring together everybody for a physical meeting. The Delphi method is based on the results of multiple rounds of questionnaires that have been sent to a panel of experts. These questionnaires are sent in multiple rounds until a consensus is reached. Marginal analysis is usually used by organizations as a decision-making tool to help them maximize their potential gains or profits. In healthcare, many spending decisions are made based on marginal analysis. It enables the health sector, whether the public or the private decision maker, to use currently available information on incremental costs and the ability to pay to assist them in making budgeting choices. The last but not the least technique of decision making we'll be looking at is the cost-benefit analysis. In healthcare evaluation, cost-benefit analysis is a comparison of interventions and their consequences, in which both costs and the resulting benefits are expressed in monetary terms. This enables two or more treatment alternatives to be compared using the summary metric of net monetary benefit. And this is the difference between the benefit of each treatment minus the cost of each. In conclusion, problems are common everyday occurrences in our lives. They occur at workplaces, including healthcare settings, homes, and communities. They are inevitable, so you cannot run away from them. Unfortunately, there is no one way in which all problems can be solved. It is therefore important to have capacity to solve problems efficiently and in a timely manner. Decision making is an important part of problem-solving process. The two of them are closely related management skills. Note that everyone, for emphasis, can benefit from having good problem-solving skills, and a good judgment is a crucial factor that determines whether problem-solving is a success or a failure. These are some suggested resources for further study on problem solving and decision making. Please note that good governance and accountability in the health system requires effective leadership, management, and governance processes and practices, of which problem solving and decision making are one. Problem solving and decision making in an efficient and timely manner enhances responsiveness in the health system and outcomes. We have come to the end of the course, and we hope you have been able to achieve the objectives that were outlined at the beginning of the course. Thank you for listening.